Hello, welcome to Canada. We hope you feel welcome here, and we hope we can help you feel healthy and safe here too. This video will help explain your health insurance, what healthcare looks like in Ontario, and how you can access this care. This is a very confusing process, even to those who have lived in Ontario for many years. To make this video easier to understand, we will label important tips in this video with stars. We will also provide links to websites with more information. These will be labeled with the picture of a computer. The links can be found below this video. As always, if you have any questions, please call Romero House and we will help you. When you entered Canada and made a claim for refugee status, you should have received your refugee claim protection document, which is shown here. You will use this document as proof of your healthcare coverage under the Interim Federal Health Program, or IFHP. If you do not have this document, you can also use your Acknowledgement of Claim form as proof of coverage. The IFHP will help pay for healthcare services while you wait for your refugee hearing date. Make sure you take these with you when you go to medical appointments. One helpful tip is to take pictures of these documents so you always have a copy of them with you in case of an emergency or in case you forget your documents at home. If you receive a positive decision at the Immigration and Refugee Board, you become a convention refugee or protected person. This means you are eligible for the Ontario Health Insurance Plan, also known as OHIP. You should apply for OHIP at Service Ontario as soon as you become a convention refugee or protected person. While you wait for your OHIP card, you will still be covered by the IFHP. However, your IFHP coverage will expire 45 to 90 days after your refugee claim is accepted. If you receive a negative decision at the Immigration and Refugee Board, reach out to your lawyer or Romero House to determine what next steps are available to you. You will continue to have healthcare access through Interim Federal Health until the date of your removal from Canada.
In Canada, family doctors and nurse practitioners are called primary care providers, as they're typically who patients first interact with in the healthcare system. Nurse practitioners, like doctors, can diagnose illnesses and prescribe medications. A visit to a primary care provider can help if you're feeling unwell and it is not an emergency, or if you need help managing a chronic illness like diabetes. We recommend that everyone should have a primary care provider who they regularly visit for all non-emergency medical problems and checkups. Your primary care provider will get to know you and your health problems over time. This will make it easier for them to help you. We recommend that refugees find a primary care provider at a community health center. These centers are more familiar with refugee needs and they often provide interpreters. Examples of community health centers include the Four Villages, Parkdale Community Health Center, and Vibrant Healthcare Alliance. You can see the link below this video for a list of community health centers in Ontario. If you haven't found a primary care provider yet, that's okay. You can visit a walk-in clinic instead. Primary care providers work at these walk-in clinics and provide services to anyone who walks in. However, the primary care provider you see at a walk-in clinic may not know you very well and may be unfamiliar with your medical condition. You might also have to wait a few hours to be seen at a walk-in clinic. In addition, the walk-in clinic may not provide interpreters. It's also a good idea to bring a family member or friend who speaks English if you need an interpreter. Despite these challenges, walk-in clinics are a good place if you don't have a regular primary care provider or if they're currently unavailable. After visiting your primary care office or a walk-in clinic, your primary care provider may write you a prescription for medication. In addition, after talking to your primary care provider, they may suggest that you see a specialist. A specialist is an expert in one part of the body. For example, if you're pregnant, you'll be sent to an OB/GYN, which is a doctor who's trained in women's health. Sometimes there are wait lists to see a specialist. You may need to wait a few weeks or even months for an appointment, depending on the type of specialist you want to see. An important thing to know is that in Canada, you need to see a primary care provider before you can see a specialist. Primary care is not always the best way to access healthcare. In the event of an emergency, you should go to the nearest hospital or call 911 for an ambulance. When you call 911, tell them it is an emergency, that you need an ambulance, and tell them your address or where you currently are. Reasons for going to the hospital or calling 911 may include difficulty breathing, chest pain, sudden dizziness or weakness, confusion, changes in vision, or coughing up or vomiting blood. When the ambulance arrives, paramedics will help you and take you to a hospital. All major hospitals in Toronto, including St. Michael's Hospital, will accept IFHP.
So, what medical services are covered for refugees? As a refugee, necessary medical care and other services will be covered by the IFHP. Examples of healthcare services fully covered by the IFHP include visits to the doctor's office, necessary blood tests and imaging such as x rays, most vaccines, maternity care, emergency care, medically necessary surgeries, and the immigration medical exam, which is probably one of the first things you got done when you arrived in Canada. There is also some coverage for vision and dental care, home care, long-term care, services from allied health professionals, assistive devices, and medical supplies and equipment. Lastly, some prescription drugs are also covered under the IFHP. While some services are fully paid for by the IFHP, others are only partly paid for. You can ask your primary care provider or an employee at Romero House to help you figure out what is covered. So, how do you access these services? First, you need to find a healthcare provider, for example, a doctor who is registered with the IFHP. If it is your first time seeing this doctor, it is important to ask if they are registered with the IFHP and its administrator, Medavie Blue Cross. If you visit a doctor who is not registered with the IFHP and you pay for a medical service with your own money, the IFHP will not be able to refund you. Always remember that if you are eligible for coverage for the service or product under the IFHP, you should not have to pay for it. You do not need to accept services from healthcare providers who do not take part in the IFHP. You can always find someone else who is registered with the program. This is why we recommend community health centers. These clinics are usually registered with the IFHP and usually provide professional interpreters. When you do visit a healthcare provider who takes part in the program, you need to show proof that you are covered by the IFHP. You can do this by bringing either your refugee protection claimant document or your acknowledgement of claim form with you. As we mentioned before, having a picture of these documents on your phone is a good idea in case of an emergency or in case you forget the papers at home. After the appointment, the doctor might ask you to sign a claim form. You must sign this form to prove you accessed a healthcare service through the IFHP. This will allow the doctor to send your medical bill to Medavie Blue Cross.
That was a lot of information. In conclusion, here are some important points you want to make sure you understand. Number 1. If you are eligible for coverage for a product or service, you should not be charged for it. Here are a few examples. Suppose you visit your family doctor for a routine checkup and the doctor orders blood tests and gives you the flu shot. You should not be charged for the doctor's visit, the blood test, or the flu shot, as these are all covered services. In another case, suppose you take your 1-year-old child to the emergency department and the doctor orders lab tests, admits your child to the hospital, and gives them antibiotics. You should not be charged for any of these services. Emergency care, lab tests, and medication administered in hospital are covered services. Number 2. If you pay for a product or service with your own money, you will not get this money back, even if the product or service should have been covered by IFHP. This is a really important fact to remember. Always make sure to visit providers who are registered with Medavie Blue Cross and show them your proof of IFHP coverage. Number 3. If you need a healthcare product or service that is not covered by IFHP, you will have to pay for it. If you access a healthcare service or product that is partially covered by IFHP, you will have to pay the difference. Lastly, number 4. While some hospitals and community health centers do provide interpreters, some do not. Furthermore, most healthcare professionals do not provide interpreters. If necessary, it is your responsibility to find an interpreter who will accompany you to your medical appointments. This interpreter can be a family member or friend that speaks English, or you can find a professionally trained interpreter who works with your local health department or community cultural organization.
We hope this video has been helpful. Welcome to Canada. We're happy you're here. Please see the links below for additional information that you may find helpful as you transition to life in Canada.